because we have been following the CCG actions. Indeed, we were at a meeting last week where I did raise questions about out-of-hospital services. Well, yes, we are aware of the initiatives, but we're also aware that there is no evidence that those initiatives will reduce the need for hospital beds. Indeed, and this is not my evidence because it only happened last week, at the CCG, in the small number of minutes they allowed for people to raise questions, I raised questions about out-of-hospital services. I asked it particularly in relation to whether they could provide prevalence evidence that they would reduce significantly the numbers of people needing hospital beds so that they could justify the closure of the beds in hospitals. Dr. Spicer answered me by saying, shaping a healthier future isn't about reducing beds. I really can comment no further on that point, but when pushed on prevalence studies, he mentioned one study in Manchester that wasn't actually about prevalence, but was about setting up out-of-hospital services, and mentioned one study about prevalence in a very similar area, of course, to ours, Torbay, as showing that it would reduce hospital admissions. One of our problems is we actually think these initiatives are good. We're not opposed to these initiatives, but we want the evidence that they can justify closing down our major acute hospital services safely by actually increasing the out-of-hospital care. I don't think they have ever provided that evidence. We have been asking for 2 years.
I don't add to that. One of the significant facts I think that we face, or difficulties, is quite simple. When we ask about the study, when we ask the CCG with detailed questions, and we really do have our research done about when we go to meetings, we're told that things are happening which actually do sound very good. But when we ask questions about the numbers involved, they're both very reluctant to answer, and when informally people answer afterwards, the number of people involved in each of the initiatives really is tiny, and the initiatives which they talk about we would love to see expand, but in terms of the need of people in this borough, it really doesn't approach the problem, and to put it as a success indicator for what's been done is as misleading as you could possibly do.
Thank you. As I said, I have no further questions before the Commission.